In that diagram also, we saw a muscle crossing in front of axillary artery. Okay, this is the axillary artery. This is the muscle crossing. This is the pectoralis minor muscle. Where is the pectoralis minor muscle located, children? Please answer. In which region pectoralis minor muscle is present? Once more.
Pectoral region, ma'am.
Yes, pectoral region. Pectoralis minor is a muscle of the pectoral region. So this pectoralis minor muscle is crossing in front of the axillary artery and dividing the artery into three parts. You can see first part, second part, and the third part. Okay. See, from here, axillary artery is starting. So this is the first part, from the outer border of the first rib to the upper border of the pectoralis minor. That is, proximal to pectoralis minor is the first part of axillary artery. Proximal to pectoralis minor or superior to pectoralis minor is the first part of axillary artery. Okay, from the outer border of the first rib to the upper border of the pectoralis minor muscle. That is the first part. Then second part is behind pectoralis minor muscle. This portion which is present behind the pectoralis minor muscle is the second part of axillary artery. Okay. Then from the lower border of the pectoralis minor to the lower border of the teres major muscle. That is the third part. That is the part which is distal to the pectoralis minor. Okay, distal to the pectoralis minor is the third part. So these are the three parts of the axillary artery. Pectoralis minor crossing the artery in front is dividing the artery into three parts. First part, second part, and third part. First part is proximal to pectoralis minor muscle, which extends from the outer border of the first rib to the upper border of the pectoralis minor muscle. Then the second part is behind the pectoralis minor muscle, and the third part is distal to the pectoralis minor muscle. That is extending from lower border of the pectoralis minor muscle to the lower border of teres major muscle. Understood? Please reply.
Yes, ma'am.
Yes, ma'am.
Okay. So pectoralis minor is crossing in front of the artery to divide it into three parts. First part proximal to pectoralis minor, second part behind pectoralis minor, and third part is distal to pectoralis minor. Okay. Coming to relations of the axillary artery. We have already said axillary artery had three parts. First part, second part, and third part. Okay. Throughout its course, axillary artery have axillary vein as its medial relation. Okay. We can see this is the first part of axillary artery. Here, axillary vein is medial. In the second part also, axillary vein is medial, and in the third part also, axillary vein is medial. Okay, while discussing about the relation, I'll give you an orientation. See, this is the axillary artery in each part. This is the first part of axillary artery. This is the second part of axillary artery, and this is the third part of axillary artery. In all these three diagrams, this is the anterior, this is the posterior, this is the medial, and this is the lateral. Okay. This is anterior, this is posterior, this is medial, this is lateral. In this diagram also, this is anterior, this is posterior, this is medial, and this is lateral. Okay. So coming to the relations of the first part of axillary artery, anteriorly you can see this is the pectoralis major muscle. Where is the pectoralis major muscle present? In which region? Please reply.
Again, pectoral region, ma'am.
Yes, pectoral region. What are the parts of pectoralis major muscle? The two heads of pectoralis major muscle? Please reply. Pectoralis major muscle has been taught to you, no?
No, ma'am.
Okay, pectoralis major muscle have got two heads, clavicular head and sternocostal head. Okay, out of that clavicular head, when you learn about pectoralis major and pectoral region, that clavicular head of pectoralis major muscle is related anterior to the first part of axillary artery. Okay, pectoralis major muscles, clavicular head. Then you can see a loop of communication between medial and lateral pectoral nerves. This is the medial pectoral nerve. This is the lateral pectoral nerves. These are the nerves supplying the pectoralis major muscle. Okay, there is a loop of communication between these two nerves. That loop of communication also comes anterior to the first part of axillary artery. Okay, these are the two anterior relations of first part of axillary artery, that is medial and loop of communication between medial and lateral pectoral nerve and clavicular head of the pectoralis major muscle. Okay, now coming to the posterior relations. Okay, do you know that one of the content of axilla is brachial plexus? Please reply.
Yes, ma'am.
Yes.
Yes, ma'am.
Brachial plexus class is over.
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay. So you know that in brachial plexus we have three codes. Please name the codes.
Lateral, medial, and
Lateral,
posterior.
posterior, or medial cord.
Yes, very good. Medial code, lateral code, and posterior code. So the medial code of the brachial plexus is related posteriorly to the first part of axillary artery. Okay. Medial code of brachial plexus. This is the medial code of brachial plexus. Then serratus anterior muscle and long thoracic nerve. Where is the serratus anterior muscle present?
Behind the breast, ma'am.
Yes, in the pectoral region, again you have studied about serratus anterior muscle. It have got 8 digitations. Out of that, first digitation is related posterior to the first part of axillary artery. Okay. Then this is the long thoracic nerve, which is supplying which muscle?
Serratus anterior.
Yes, serratus anterior muscle. Okay. So these are the three posterior relations of the first part of axillary artery, that is medial cord of the brachial plexus, long thoracic nerve which supplies the serratus anterior muscle, and the first digitation of the serratus anterior muscle. Okay. Now coming to the medial relation, as I have already said, throughout its course, the axillary vein is medial to axillary artery. So here the first part medially we have axillary vein. Okay. Then laterally we have the remaining two codes of brachial plexus, that is the lateral code of brachial plexus and the posterior code of brachial plexus. Okay. So these are the relations of first part of axillary artery. Now coming to the second part of axillary artery, here anteriorly we have pectoralis minor muscle. Posteriorly, we have posterior cord of the brachial plexus and subscapularis muscle. Subscapularis muscle you will learn in detail when you will be taught about the scapular region. Okay, it is a muscle of the scapular region. Posterior cord of brachial plexus and subscapularis muscle comes posterior to the second part of axillary artery. Then medially we have axillary vein, like I already said throughout the course, medial is axillary vein, and also we have medial cord of the brachial plexus. Okay. Then laterally we have lateral cord of the brachial plexus. There is a peculiarity in second part of the axillary artery, that is the relation of codes of brachial plexus is according to the name of the codes. That is, medial code of the brachial plexus is medial, posterior code is posterior, and lateral code is lateral to the second part of the axillary artery. Okay, that is about the second part of axillary artery. Anteriorly, pectoralis minor. Posteriorly, we have posterior code of brachial plexus and subscapularis muscle. Medially, we have axillary vein and medial cord of brachial plexus, and laterally we have lateral cord of brachial plexus. Okay, is it clear?
Yes, ma'am.
Okay. Now coming to the third part of axillary artery. Third part of axillary artery, anteriorly related to medial root of median nerve. Did you study about the median nerve in brachial plexus?
No, ma'am.
Yes, ma'am.
Yes,
Yeah.
ma'am. Yes,
Okay.
ma'am.
Median nerve is arising from the brachial plexus. It have got two roots. Which are the roots?
Lateral root and
Lateral
medial
root of
root.
median.
Yes, very good. Medial root and lateral root. So that medial root of median nerve is coming anterior to the third part of axillary artery. Okay. Then posteriorly we have axillary nerve, radial nerve. Again, axillary nerve and radial nerve are arising from
Median cord.
Posterior.
Median
Posterior
cord.
cord.
yes, from the brachial plexus we have axillary
Medial.
nerve and radial nerve. Posterior relation, then we have subscapularis muscle and teres major muscle posteriorly. Okay, posteriorly four relations: axillary nerve, radial nerve, subscapularis muscle and teres major muscle. Okay, medially we have again axillary vein, medial cutaneous nerve of forearm, and ulnar nerve. These nerves are again arising from the brachial plexus. Okay, medial cutaneous nerve of forearm, ulnar nerve, and axillary vein, medial relation. Laterally, we have musculocutaneous nerve. Musculocutaneous nerve again arising from
Lateral cord.
Lateral
yes,
cord.
Lateral cord.
yes, lateral cord of brachial plexus. That is a musculocutaneous nerve. Okay, so this is about the relations of three parts of axillary artery. First part, second part, third part. Is it clear?
Yes,
The
ma'am.
same diagram is given in your textbook also. Please refer that also, okay, when you're studying. Now coming to the branches of axillary artery.
Excuse me, ma'am.
Yes, yes.
Ma'am, what is this loop of communication in the first part? What is it? Fascia, deep fascia, or any other covering?
No, it is a fascia covering it. Hello, can you hear me?
Yes, ma'am. Thank you, ma'am.
Oh, okay. Now, coming to the branches of the axillary
Ma'am,
artery.
why forming the loop?
Hmm?
Ma'am, why these forming the loop? Why they are communicating?
Because they both are supplying the pectoral region. The pectoral muscles are supplied by medial and lateral pectoral nerves. Okay, that is why. Hello?
Okay, ma'am.
Okay. Now coming to branches of the axillary artery. From the outer border of the first rib to the upper border of the pectoralis minor is the which part of axillary artery?
First part.
Yes, first part of axillary artery. We can see we have only one branch arising from the first part of axillary artery. One branch from the first part of axillary artery, and behind the pectoralis minor is the
Second part.
second part. From the second part, we have two branches arising from the second part, and from the third part, we have three branches arising. Okay. So one branch arises from the first part of axillary artery, two branches from the second part, and three branches from the third part. Okay, you can see this is the superior thoracic artery which arises from the first part of axillary artery, superior thoracic artery. Only one artery arising from the first part. Then from the second part, you can see this is the thoracoacromial artery. Thoracoacromial artery which arises at the upper border of the pectoralis minor muscle. This is the thoracoacromial artery, and at the lower, passing down the lower border of the pectoralis minor is the lateral thoracic artery. Okay, lateral thoracic artery. Then these are the two arteries of the two branches arising from the second part. Then from the third part we have Subscapular artery, this is the largest branch of axillary artery. Subscapular artery, anterior circumflex humeral artery, and posterior circumflex humeral artery. Okay, these are the three branches arising from third part. Yes, you can see from the first part only one branch, superior thoracic artery. From the second part, two branches, thoracoacromial artery and lateral thoracic artery. From the third part, we have subscapular artery, anterior circumflex humeral artery, and posterior circumflex humeral artery. Okay. Now coming to each branch. From the first part, I have already said superior thoracic artery. Here you can see this is a branch, superior thoracic artery arising from the first part. You can see it is arising near the subclavius muscle. It is arising near the subclavius muscle and it runs between pectoralis major and minor muscle. So the superior thoracic artery is supplying the pectoralis major and minor muscles and also medial wall of the axilla. Coming to thoracoacromial artery, which is a branch arising from the second part. You can see it is arising at the upper border of the pectoralis minor muscle and it pierces the clavipectoral fascia and see arising at the upper border of pectoralis minor muscle. It pierces clavipectoral fascia and then it divides into four branches. Clavicular branch, this is a clavicular branch, this is the pectoral branch, this is the deltoid branch, and this is the acromial branch. Okay, this clavicular, these are the four branches. Four again. Thoracoacromial artery is a branch of second part of axillary artery. These are the branches of thoracoacromial artery: clavicular branch, pectoral branch, deltoid branch, acromial branch. This clavicular branch is supplying the sternoclavicular joint and the subclavius muscle. Okay. And this pectoral branch is supplying the pectoral muscle, that is the pectoralis major and the minor muscles. And deltoid branch is supplying is going towards the deltopectoral groove. Okay, deltopectoral groove is a groove which is present between the superolateral aspect of the pectoral region and the deltoid muscle. Okay, then acromial, this is the acromial branch. Acromial artery is ending by anastomosing over the acromion. This you will study in detail when you will be taught about the scapular anastomosis. That is your next class. In that, you will be taught that this acromial artery is ending by anastomosing over the acromion. Okay. Now coming to lateral thoracic artery. Again, this is also a branch.
anastomoting point clear कर दीजिए.
It is anastomosing over acromion. It is a part of scapula. That you will study in detail when you will be taught about scapular anastomosis. Okay, today you have one more class in which you will be taught about scapular anastomosis. In that, this will be discussed in detail. Scapular anastomosis will be discussed in detail. Okay.
Ma'am, can you repeat? Clavicular branch supplies where, in which region?
Clavicular branch is supplying the sternoclavicular joint and the subclavius muscle.
Okay, thank you.
Now coming to lateral thoracic artery. Again, this is a branch of second part of axillary artery. It is passing along the lower border of the pectoralis minor muscle. Lower border of the pectoralis minor muscle, and it is supplying pectoralis major, minor, and also serratus anterior muscle. Okay. This lateral thoracic artery have got importance in females. It gives lateral mammary branches also to supply the breast. Okay, lateral thoracic artery gives lateral mammary branches to supply the breast in females. Okay. Coming to subscapular artery. Now we'll be discussing about the branches of third part. Subscapular artery is coming from the third part of axillary artery. You can see this is the largest branch of axillary artery. Okay, largest branch of axillary artery, and this passes through the lower border of the subscapularis muscle. Subscapularis muscle is a muscle of the scapular region. Okay, it passes through the lower border of the subscapularis muscle towards the inferior angle of the scapula. Okay, inferior angle of the scapula. It gives one more branch, that is the circumflex scapular artery. Circumflex scapular artery. Okay. When you will be taught about the back region, you will be taught that there are intermuscular spaces, upper triangular, lower triangular, and quadrangular intermuscular spaces. That you will be taught in detail. In that, you will learn that this circumflex scapular artery is passing through the upper triangular space. Okay, there are three spaces: upper triangular space, lower triangular space, and quadrangular space. Out of that, circumflex scapular artery is passing through the upper triangular space. Okay, that is about the subscapular artery.
Ma'am, please repeat what you just said.
Circumflex scapular artery is a branch of subscapular artery. Okay, understood? Hello, can you hear me?
Yes, ma'am. You said many other
Yes.
things.
Yeah, that will be, okay. Subscapular artery have a branch, circumflex scapular artery. This circumflex scapular artery is passing through the upper triangular intermuscular space. Next class you have class about the back region. In that you will be taught about spaces, intermuscular spaces. There are three intermuscular spaces: upper triangular space, lower triangular space, and quadrangular space. Okay, out of that, this circumflex scapular artery is passing through the upper triangular space. Understood? That you will be taught in detail. Intermuscular spaces is a separate class for you. Understood?
Yes, ma'am. Thank you, ma'am.
Okay. Now coming to anterior circumflex humeral artery. Okay, this is again arising from the third part of axillary artery. Branch of third part of axillary artery. This anterior circumflex humeral artery is winding around in front of the surgical neck of the humerus. Humerus class is taken for you. The class on bone humerus. Please reply.
No, ma'am.
No, ma'am.
Oh, okay. When you will be taught about humerus, you will study that humerus have a surgical neck. This anterior circumflex humeral artery is passing in front of the surgical neck of humerus, and it is anastomosing with the posterior circumflex humeral artery. Okay, posterior circumflex humeral artery. This anterior circumflex humeral artery gives a small branch which is called ascending branch. That ascending branch moves upwards into the intertubercular sulcus of humerus. It is again seen in intertubercular sulcus is present in humerus. So this ascending branch of anterior circumflex humeral artery will move upward into the intertubercular sulcus of humerus and will supply the head of the humerus and shoulder joint. Now coming to posterior circumflex. This is the last branch which is arising from third part of axillary artery, that is a posterior circumflex humeral artery. You can see comparatively, compared to anterior circumflex humeral artery, this is a larger branch. Okay. This have said there are three spaces. Out of that, this posterior circumflex humeral artery is passing through the quadrangular space at the back. Okay, it passes to the quadrangular space. and it winds around the posterior aspect of surgical neck of humerus to anastomose with this anterior circumflex humeral artery. Okay, so anterior circumflex humeral artery passes in front of the surgical neck of humerus, and posterior circumflex humeral artery passes in the posterior aspect of the surgical neck of humerus, and both of them anastomose with each other. This posterior circumflex humeral artery is supplying the deltoid muscle and the shoulder joint. Coming to clinical significance, axillary artery pulsation can be felt at the lower part of the lateral wall of the axilla. Okay, axillary artery can be felt at the lower part of the lateral wall of the axilla. In that same region, that is at the lower part of the lateral wall of the axilla, this axillary artery can be compressed to control bleeding from the distal part of the upper limb. I have already said the axillary artery is continuing as which artery at the lower border of the teres major muscle? Brachial artery. Yes, brachial artery. Axillary artery is continuing as brachial artery at the lower border of the teres major muscle. So, if to control bleeding from the distal part of the upper limb, if we apply pressure at the lower part of the lateral wall of the axilla, the bleeding will stop. Okay, that is about axillary artery.
Ma'am, excuse me,
Yes,
ma'am.
yes.
Can we palpate axillary artery in ourselves?
Yes, in deep palpation, you will get at the lower part of the lateral wall of the axilla. Okay. So, axillary artery, a quick revision. Axillary artery is a continuation of subclavian artery at the outer border of the first rib, and it terminates as brachial artery at the lower border of the teres major. It is terminating as brachial artery. Axillary artery have three parts, which is divided into three parts by pectoralis minor muscle into first part, second part, third part. First part is proximal to the pectoralis minor muscle. Second part is deep to pectoralis minor muscle or behind the pectoralis minor muscle, and distal to pectoralis minor muscle we have third part. In all the three parts we have axillary vein medially. Apart from that, anteriorly we have in the first part pectoralis major muscle, clavicular head, and the loop of communication between medial and lateral pectoral nerves. Posteriorly, we have medial cord, serratus anterior muscle, and long thoracic nerve. Medially, axillary vein, and laterally, lateral cord and posterior cord of the brachial plexus. In the second part, the cords of the brachial plexus are related according to the names of the cords, that is, medial cord is medial, posterior cord is posterior, and lateral cord of the brachial plexus is lateral to the second part of the axillary artery. Anteriorly, we have pectoralis minor muscle. Apart from the medial cord, we also have axillary vein medially. Posteriorly, other than posterior cord, we have subscapularis muscle, and laterally, we have only lateral cord of the brachial plexus. In the third part, anteriorly, we have medial root of median nerve. Posteriorly, we have axillary nerve, radial nerve, subscapularis muscle, and teres major muscle. Medially, we have axillary vein, medial cutaneous nerve of forearm and ulnar nerve. And in the lateral part, we have musculocutaneous nerve. Okay. Then branches, we have totally 6 branches. 1 branch from the first part, 2 branches from the second part, and 3 branches from the third part. From the first part, we have superior thoracic artery, which is arising near the subclavius, and it is supplying pectoral muscles and medial wall of the axilla. From the second part, 2 branches. First is the thoracoacromial artery, which is arising at the upper border of the pectoralis minor muscle, piercing clavipectoral fascia and dividing into 4 branches: clavicular branch, pectoral branch, acromial branch and the deltoid branch. Then the third branch is the lateral thoracic artery, which runs down the lower border of the pectoralis minor muscle. This have got significance in females because it is also giving lateral mammary branches to supply the breast. From the third part, we have three branches. Subscapular artery. Subscapular artery is the largest branch of axillary artery. It gives one more branch, which is the circumflex scapular artery. Then we also have anterior circumflex femoral artery and posterior circumflex femoral artery. From the third part of axillary artery, this anterior circumflex femoral artery winds in front of the surgical neck of humerus, and posterior circumflex winds around posterior aspect of surgical neck of humerus, and both these anastomose with each other. Okay. Clinical significance is axillary pulsation and compression of it to stop bleeding. Okay. Now we'll go on to axillary vein. See, here you can see this is basilic vein. Basilic vein is the vein of the upper limb. This basilic vein unite with the brachial veins. These are the paired brachial veins. Okay. Paired brachial veins unite with the basilic vein to form axillary vein at the lower border of the teres major muscle. This is the lower border of the teres major muscle. At this lower border, these three veins, paired brachial veins and basilic vein, unite to form axillary vein. So from lower border of teres major up till outer border of first rib, we have axillary vein. Then at the outer border of axillary vein, this vein is forming subclavian vein. Okay, subclavian vein. So this is the axillary vein, which is formed by the union of basilic vein and paired brachial veins at the lower border of the teres major muscle. Then it will, at the outer border of the first rib, this axillary vein is becoming subclavian vein. Okay. Tributaries, again you can see, this is the most important tributary is cephalic vein. Cephalic vein is a vein of the upper limb. This cephalic vein is the main, most important vein which is draining into the axillary vein. Other veins correspond to the branches of the axillary artery, that is lateral thoracic vein and subscapular vein. We have already learned lateral thoracic artery is a branch of second part of axillary artery and subscapular artery is a branch of third part of axillary artery. So these veins are corresponding to the branches of the axillary artery. These are the tributaries of axillary vein: cephalic vein, lateral thoracic vein, and subscapular vein. Cephalic vein is the most important vein which is draining into axillary vein. Coming to clinical significance. Okay, when yes. Hello.
Ma'am, can you please show the first slide of axillary vein?
This is the first slide of axillary vein. Or the picture you want to see?
No, ma'am, this only. Thank you.
I have explained this. See, axillary vein is formed at the lower border of the teres major by union of basilic vein and vena comitans of brachial artery means the vein which is accompanying brachial artery. That is what I have showed there, paired brachial veins. Okay, vena comitans of brachial artery and basilic vein unite at the lower border of the teres major to form axillary vein, and it ends at the outer border of the first rib by becoming subclavian vein. This is what I have already explained in the picture. Okay. Okay, clinical significance is axillary vein thrombosis. When, yes,
What is this?
yes,
Then what is tributaries?
the veins which are draining into axillary vein. The veins which is draining into the main vein. Okay. Can you hear me? Hello. The veins which are draining into the main vein. Okay. Can you hear me? Please reply.
Yes, ma'am. Yes, ma'am. You are audible.
Yes, yes. Coming to the clinical significance, is axillary vein thrombosis. Thrombosis means clotting of the blood. Okay, clotting of the blood. When a person keeps his hand in prolonged abduction, this axillary vein gets compressed by the subclavius muscle, part of the axillary vein. That is part of the axillary vein in front of the first part of the axillary artery gets compressed by subclavius muscle when a person keeps his arm in abduction for prolonged period. This will result when the axillary vein is compressed, there will be clotting of the blood in that part of the axillary vein, and that is known as axillary vein thrombosis. This is the clinical significance of axillary vein. Okay. Okay, that is all about today's class. Axillary vein, I'll give you a quick revision. Axillary vein, it is formed at the lower border of the teres major muscle by the union of basilic vein and the brachial veins. Then it ends by becoming subclavian vein. At the outer border of the first strip, it is becoming subclavian vein. The main tributaries, the most important tributary is cephalic vein, which is draining into the axillary vein. Other veins correspond to the branches of the axillary artery, that is the lateral thoracic vein and the subscapular vein. Clinical significance is axillary vein thrombosis, that is when person keeps the arm abducted for prolonged period above head, the part of the vein which is in front of the first part of the axillary artery gets compressed by subclavius muscle, and it will result in axillary vein thrombosis. Okay. Any questions? Hello, am I audible?
Excuse me.
Hello.
Yes, ma'am, you are audible.
Yes, the class is clear for you people? Hello. Please reply.
मैम
Yes.
मैम सर्कमफ्रेंसेस की सप्लाई बता दीजिए किस किस पार्ट को सप्लाई करते हैं
किसके?
आर्टरीज में मैम थर्ड पार्ट से जो अगली आर्टरी से के पार्ट है ये सर्कमफ्लेक्स इनकी सप्लाई बता दीजिए किस किस पार्ट को मैम.
Okay. Circumflex, this subscapular artery is passing through the lower border of the subscapularis muscle. Okay. This subscapular artery is the largest branch. It is passing through the lower border of the subscapularis muscle. So it will supply that muscle, and it ends at the inferior angle of the scapula. Okay, inferior angle of the scapula, passing through the lower border of the subscapularis muscle. Subscapularis muscle is a muscle of the scapular region, and this branch circumflex scapular artery is passing through the upper triangular space, and it is winding around the lateral border around lateral border of the scapula. Then it will reach the infraspinatus fossa. In scapula, you will learn about infraspinatus fossa. Okay, that is how this circumflex scapular artery is ending. Is it clear?
Ma'am,
Then
ma'am,
anterior, yes.
ma'am, the slide you have shown for the third particular branch of the axillary artery, the dorsal side, it was written subscapularis and teres major. But in BDC, page number 55, it is written latissimus dorsi and teres major. So just clear out this confusion.
Which branch? Subscapular artery.
Ma'am, third part of the axillary artery. In your slide, it is written subscapularis, but in BDC, page number 55, it is written latissimus dorsi.
It is subscapularis muscle. Subscapularis muscle. Subscapular artery is passing through the lower border of the subscapularis muscle. Okay.
तो मैम ये BDC वाला गलत लिखा है ना latissimus dorsi?
No, it is related to latissimus dorsi also. Latissimus dorsi is a muscle of the back. Okay.
Okay, ma'am. Thank you.
It is supplying both subscapularis and latissimus dorsi. Okay.
Yes, ma'am. Thank you, ma'am.
Okay. Okay. Thank you, children.